all consider your knowledge in and around trauma-informed care in CACs, or improving trauma-informed cares in CAC. So that being said, I'm going to go ahead and switch us back to our presentation here, and we will go ahead and begin today's webinar. Right, here we go. So again, welcome everyone, and thank you all so much for joining today's webinar, Trauma-Informed Care and Practice in a CAC webinar series. This is part 3 of our webinar series. Today we'll be focusing on assessing and improving trauma-informed care in children's advocacy centers. My name is William Moore, and I'm with OJJDP's National Training and Technical Assistance Center. And before we get started with today's webinar, I'd like to just go over a few parts of the technology to keep in mind during today's presentation. Please note that today's webinar is being recorded and will be published on our YouTube page in the next 24 to 48 hours. Please note that on our YouTube page, you can view past or archived webinars. If you'd like to get access to transcript or any supporting materials related to those archived webinars that we have on our YouTube page, please reach out to the OJJDP TTA Help Desk at OJJDP TTA@USDOJ.gov. For those wishing to download a copy of PowerPoint slides or handouts that are related to today's webinar, you may do so by locating the PowerPoint and handout pod that is right next to the chat pod here. You'll simply click on the name of the file and then click the download button, and it will download directly to your device that you're joining from. Please note that questions will be addressed during today's webinar. So as our presenters are presenting, please feel free to type in your questions related to the content in the chat, and we will address them at the very end of today's presentation. Simply type your question and then hit either enter or the bubble icon in the chat, and you will submit your question there. Now, please note that individuals who are joining today's webinar will receive a certificate of attendance. It should come in an automated feedback email, but please note that we may send it through a constant contact email from OJJDP's NTAC, where we will provide you with your certificate of attendance for today's webinar. Now, really quickly, I want to do a quick exercise with everyone so that we can get a good attendance of how many people that we actually have joining us. So if you could go into the chat box and type in the total number of additional people in the room with you today. If you're viewing by yourself, there's no need to type anything at this time. However, if you're viewing with, say, 1 additional person or 2 additional people, type in the total number of additional people with you today. For example, today is me and my dog that's right next to me, that hopefully he'll be quiet. I will type 1 additional person is currently viewing the webinar with me. So please type in the number of additional people in the room with you today. Please note that if you do have additional folks that are in and not signed in, please take a moment to download the group validation form. You can complete that and send it to OJJDP TTA at USDOJ.gov, and we will get a certificate to those additional people who have joined with you today for today's webinar. Please take a moment to review the agenda for today. And now I would like to turn it over to our presenter and moderator, Ms. Sally Kerr, for today's presentation. Sally, take it away.
Thank you, William, and greetings to everyone who is joining us in the 3rd of our webinar series. The webinar series has been named the Trauma-Informed Care and Practice in a CAC CAC setting, and the webinar has been supported by OJJDP and is a project funded by a grant that Western Regional CAC has received from the Department of Justice and the Office of Juvenile Justice. As we said, this is the third in a series. The first webinar has been put on the YouTube channel of NTAC and was specifically about trauma-informed practices and trauma-informed approach to investigating child abuse. The second in the series is also on that channel and was specifically ways for multidisciplinary professionals to incorporate trauma-informed practice and skill in the systems that they represent in the MDT. And today's webinar is being brought to us by Jennifer Hostler and is the use of a trauma-informed organizational assessment tool to help inform a CAC as they look to improve their skill sets in trauma-informed practices with families and children. So I will introduce Jennifer Hostler. Jennifer comes to us as the project manager for Project Intersect at the Georgia Center for Children's Advocacy. She has over 20 years of social work experience with extensive expertise in child welfare practices, training, and system change across the country. She has worked with traumatized children and their families in child advocacy centers, residential treatment centers, and hospitals in Minnesota, California, and most recently in Atlanta, Georgia. She is an active member of the National Children Traumatic Stress Network, has been with them since 2013, and has provided multiple trainings across the country on trauma-informed practices and secondary traumatic stress for child welfare workers, supervisors, and caregivers. She received her Bachelor of Arts degree in Psychology and Social Work from Luther College in Iowa, and her Master's degree in Social Work from San Diego State University. So we want to welcome Jennifer, and thank you so much for bringing this topic of assessment to us today.
Hi, Sally. Thanks for having me. Can you hear me okay?
Yes.
Excellent. Well, good afternoon, everyone, and for some of you, good morning. I know depending on where you are, for some it's still morning. I am calling in from Atlanta, Georgia. As you heard, I have moved around a bit. I'm originally from Minnesota, which is where I kind of got my social work start as a child welfare worker. So my introduction to child advocacy centers came very early on in my career as a child welfare worker. So bringing children for forensic interviews, collaborating with them throughout the course of an investigation in child welfare. And then I moved to California because, let's be honest, winter, I'd had enough of winter and I needed to go somewhere warm. So I ended up in San Diego, also worked in child welfare, and most recently was at the Child Advocacy Center there, which is the Chadwick Center, who also houses the Western Regional CAC. So kind of coming full circle a little bit, thanks to Sally for finding me and having me. I say all that just to share that I have a pretty wide lens of working with CACs from both being a professional in child welfare and then in my role at the CAC in San Diego and now here in Atlanta. So that's the lens that I bring. I really do have a child welfare lens, and throughout the last 7 years, starting with my time at the Chadwick Center, really began to dig into this idea of trauma-informed systems and what does that mean. So when I was at the Chadwick Center, worked with 5 jurisdictions around the country, child welfare jurisdictions, to help their systems become more trauma-informed. And so I have some real-life experience of actually doing child welfare work, and then also in the last 7 years, I've just really learned so much about what it actually means to be trauma-informed. How do we actually make that happen? What does it look like in practice? And what are some tools that we can use to help us along the way? So today I'm going to tell you a little bit about our experience at the Georgia Center, GCCA for short, tell you a little bit about our experience using one particular tool, and I'm going to, assessment tool rather, I'm going to tell you a little bit more about like why we chose that tool, what that tool is specifically designed to do, and share with you a little bit of our results and also some of the work that has happened after that. So a little bit about me. I want to tell you now a little bit about the Georgia Center. As I mentioned, we are in Atlanta, so we are a very urban city living CAC. We are a nonprofit community-based, so we are not affiliated with the hospital or university, so we are a community-based child advocacy center. And we serve 2 counties, Fulton and DeKalb counties, so we have 2 locations. The city of Atlanta encompasses primarily Fulton County, but there are parts of the county, of the city rather, that are also in DeKalb County. And so there are other cities in DeKalb County as well. So we serve those other cities as well. So the metro Atlanta area, as I like to say, which is a huge city. We have 34 staff in both of our locations. I mentioned that we are community-based, and one of the things about our center that I think is really fantastic is that our services are free. So we don't have to worry about insurance, which we know for some families can be a barrier. Everything we do is free, from the therapy we provide to the forensic interviews and all of the community-based training that we do. So that's one of the things that I think is really great about our organization. We do all the things that CACs do, including forensic interviews. We have 5 therapists on staff. We also have family advocacy folks that provide family advocacy services to our families who are coming in for forensic interviews. One of the great things about us as well is we have a prevention department. So we have a whole team focused on actually preventing childhood sexual abuse. And we've done a lot of training around the state of Georgia in child sexual abuse prevention for adults, and are now getting into a new training called Connections Matter, which is really focused on adverse childhood experiences and looking at the impacts of toxic stress, but then also resiliency, and how do you build resiliency, and how do you help kids heal. So that's another great thing about us. I love the fact that we have a prevention team doing all this great work across the state. We have a development team who does all of our fundraising, because as I said, our services are free, so we have to have money and we have to get donations and planning special events and things like that. And then we also have 2 federal grants. So Sally mentioned I'm the project manager for one of those grants, which is called Project Intersect, and our funding comes through SAMHSA, the Substance Abuse and Mental Health Services Administration, and we are an initiative of the National Child Traumatic Stress Network. So I'm going to be talking a lot about the NCTSN today. So SAMHSA also funds the NCTSN, and so folks who are receiving money from SAMHSA under our particular grant become members of the NCTSN, which is an amazing resource. I'm going to share a lot of resources with you today. So in all the work that we're doing, we are a leader in statewide initiatives. I've mentioned our prevention training that we do. We've trained over 14,000 adults in the state of Georgia in the Stewards of Children, which is a darkness to light for folks that are familiar, a child sexual abuse prevention training. And then we've just launched our new Connections Matter training, which is the ACEs, Informed, Toxic Stress, and Resiliency. So we've trained over 1,000 people already, and we just started that program this year. So I say all of that to let you know that we feel we really have a duty to be responsible and be trauma-informed in the work that we do, just because of not only the services that we provide, but also the variety of trainings and other partners in the state that we're working with. We really feel that we have a great influence over our community as a whole. So through our grants, we're able to do a lot of really cool stuff. My particular grant, and then we have another grant which the funding comes through the Office for Victims of Crime. Both of those grants have a focus on working with trafficked youth. So you see that CSEC acronym, that means Commercial Sexually Exploited Children. So children who have experienced child sex trafficking and exploitation. We have 2 special grants with a focus on working not just with those youth, but also with the systems that those youth come into contact with, which often includes child welfare, juvenile justice, law enforcement, the court system, things like that. So it's pretty exciting that we have those grants, and it allows us to do a lot of great things. Now what you see here in this picture is actually our brand new location in Fulton. We have been moving, we're in the process of moving and planning to move for the past several years, and it finally has happened, and it's very exciting. So we actually moved over the summer during a pandemic, so no small chore there, but we moved into a brand new space that's actually kind of a collective of spaces. So it's It's a large industrial space. I believe it used to be a Coca-Cola distribution warehouse site. So it's a huge warehouse site with a bunch of different businesses and art like stations. We have some food trucks. We have some youth-led organizations there. So it's really exciting. It feels very much like community. And so as we go throughout this presentation, I'm going to be showing you some pictures of our new space because we're really excited about it. And we also feel that having a new space is not always a thing, right? So we feel very lucky that we suddenly have kind of a blank slate to work on when it comes to creating a safe space for families. And as we talk about being trauma-informed, creating safety, not just physical safety, but also psychological safety is really, really important. So that photo that you see there is actually the exterior of, well, a part of the exterior because it is a very large space, but this is just to kind of give you a feel that it's pretty industrial. So here are a couple other photos. So once you get onto the campus, you have to wind down some rows and you find our space. So you'll see there's the exterior of to the lobby. So that's where our families will come in. It's a secured door. So we have to know that they're coming and we buzz them in and we have someone up in the front lobby at all times to welcome folks. Now, given COVID, that has changed quite a bit. We don't have nearly as many people coming and going as we normally do. So we are adjusting with the times, as are all of you. And then the photo on the right, just kind of when you walk into one of our big open area spaces, it's just a really vast, open, industrial looking space with a lot of white walls. So you can see that there's a lot of opportunity there for us to create a space as we see fit, right? And as we begin to settle in and hear from our families about what's important to them and what helps them feel safe, that's something that we'll be incorporating. So we've got a lot of blank walls right now, but we're looking forward to settling in a bit further in the near future. And then I mentioned all the training that we do. So this is one thing that we're really excited about. We did not have a training space at all in our last place. And so having this kind of state-of-the-art, in my opinion, training space is really exciting, and actually you can divide it up into two separate rooms, so we can host 2 trainings at the same time, and there's actually a garage door that opens, which we didn't really know at the time, but in the time of COVID is actually a really great benefit. So we are certainly not back to work full-time, but our work has been essential, so we've had to continue doing forensic interviews, and other therapy obviously has really transitioned to telemental health, but there have been instances where we've had to have smaller groups of people, and so we've been able to do that safely while opening the garage door and everyone really being distanced, physically distanced and wearing masks. So we're really excited about this training space, just again because of all of the training that we do across the community. So in the past, we've had to call up friends and ask for favors. Hey, can we come use your training space one more time? But we don't have to do that anymore because we have our own space. So I just want to give you a little bit about who we are and who we serve. In 2019, we conducted 729 forensic interviews across both of our centers. You'll see primarily we're serving females. 72% of the interviews we conducted were youth who are identifying as female, and a smaller portion of male children. And then in terms of race and ethnicity, you'll see that we primarily serve African American children, which is really important as we think about being culturally responsive, which is part of being trauma-informed. It's been something that we've been paying a lot closer attention to, just with everything that has happened this summer, and in light of various deaths at the hands of police. And we have police in our center, and we have children, primarily children of color, coming to our center. So it's just been really important for us to be really aware of this and be mindful of how we're approaching our families and how we're helping them feel safe when they come to us. And then a little bit about our clinical services. We served 139 children in therapy. So that meant 1,342 therapy sessions were completed last year with those 139 children. And I will say that we use the treatment model that we use is TFCBT, Trauma-Focused Cognitive Behavioral Therapy, which I'm sure many of you are familiar with. This is an evidence-based treatment, and so again, when it comes to being trauma-informed, using stuff that works is really important. And so we've been using this model of treatment for as long as I know. I've been at the Georgia Center 4 years, and I want to say they've been using it for at least 10 years. So again, 72% of our therapy clients are female and 73% are African American. We also have, we're the only provider in the state of Georgia that provides problematic sexual behaviors group for children ages 7 to 12. This is another evidence-based treatment for children who are exhibiting problematic sexual behaviors, whether it's as a result of their own abuse or if it's other types of behaviors that just need to be kind of figured out and worked out. So our team, our therapy team, hosts a group once a week. And again, it's for ages 7 through 12. But the great thing about this particular model is that it also includes the caregiver. So there's a caregiver segment where the caregivers come and they go with half of our therapists, and then the children receive, their treatment in a group setting, separately without their parents, and then they come together at the end of each group. So it's really involving the caregiver, which we know is really important, especially around things like problematic sexual behaviors where you need to set a lot of boundaries and there needs to be a lot of supervision. So caregivers really need to be included in this process. So a lot of evidence-based treatments that we're using, which is really critical when implementing trauma-informed practices. One of the great things that I get to do is work with foster parents, and this is one of the goals of our particular grant that I manage. And we use an NCTSN curriculum called the Resource Parent Curriculum, and it is an 8-module course, so it's 16 hours of training. So it's definitely a commitment from the foster parents. And so this is something that I do. We help train them on trauma. We help them understand the impact of trauma on children's behavior, their overall development. And the idea behind this is really to minimize placement disruptions. We know that kids in child welfare often get bounced around from place to place. And sometimes it's just a matter of foster parents or whoever that caregiver is not being fully prepared or fully knowing what to expect. And so that's one of our goals in doing this foster parent training, is to help educate them on trauma and really prepare them so that we can minimize placement disruptions, because we know that's really traumatic for kids. We also train other therapists in trauma-focused cognitive behavioral therapy. So that's one of the great things about our grant that allows us to train therapists across the state of Georgia. As I mentioned, we have 5 therapists on site. So, you can only reach so many kids in an evidence-based model with 5 therapists. So our model really is to train other therapists across the state, especially in rural areas where we know kids may not have access to resources. And now in the days of COVID, with telemental health being so popular and needed right now, it really allows us to reach youth that may not otherwise have access to TFCBT. So that's one thing we're really excited about. And then our Envision events is our other grant that I mentioned, which is funded through OVC. So this particular project works specifically with trafficked youth, all girls so far, only because the residential programs that we have in Georgia only serve girls. But we have ongoing events with them, from independent living skills. We talk about career readiness, how to apply for college. There's like health and wellness. So there's been yoga events and cooking with the kids. And we have a host of volunteers that help out with those. And those events right now with COVID are happening weekly because we partner with several facilities around mostly Atlanta, but there are a few outside of the city of Atlanta. So that is another exciting thing that we're doing. I saw there's a question about the curriculum for trauma-informed parenting. It's called the Resource Parent Curriculum, also abbreviated as RPC. So it's a National Child Traumatic Stress Network curriculum. So if you just Google Resource Parent Curriculum, NCTSN, you'll find a link to it. And we love the curriculum. It's wonderful, and the foster parents really love it. Okay, so we're going to take a pause here for a moment. We're going to do a bit of a polling question. And the reason I like to ask that question is because we often have different ideas of what it means to be trauma-informed. It means different things to different people. So what I'd like everyone to do is just take a moment, and when I say trauma-informed child and family system, what does that mean to you? What types of words or things come to mind, concepts, ideas when I ask that question? What does a trauma-informed child and family system mean to you? So I see responsive care, resources. Staff are calm and empower families without shame or punishment. I love that. Having a family lead the conversation, providing options to the family, recognizing and responding to the impact of trauma, learning resources, screening sensitivity to triggers and resources, understanding that trauma can affect the child and family members differently and behaviors can be different for everyone. We need to recognize that not everyone responds the same. Absolutely. Not re-traumatizing. Yes, absolutely. A big part of trauma-informed care is avoiding re-traumatization. Strength-based responses to individuals, families, and communities. I love that, inclusion of communities. Having resources necessary to help the family and child based upon their specific trauma. That's really important. And not everyone has resources available to them, so that can be a challenge for sure. You guys are smart. These are awesome. I think we'll just give it like another minute while some answers are coming in. A support system for youth and families to move forward. Absolutely. Looking at immediate and long-term needs. Excellent. I think that looks like that might be it, William. If we want to go back to the slides. You guys are really smart, and you know exactly, you guys know this is not news to you, which is really exciting. So again, but you could see even in those answers, there was a wide variation of answers, right? And there's, you know, you guys all had right answers, and at the same time, you know, there's many different definitions about what it actually means to be trauma-informed. Now, this definition is very wordy, so I'm not going to read it to you, but you'll notice many of the things that you all mentioned are included in here. And this is a definition that comes from the NCTSN. So you'll notice a theme here, referencing the network quite a bit, the NCTSN, but looking at, it's one in which all parties, right? So it's not just about the social workers or the quote-unquote mental health people recognizing it, right? That everyone has to recognize, everyone in your organization, from the folks who answer the calls and the folks who are, you know, waiting in the lobby when families come in and getting them settled, and to the family advocates, to the law enforcement officers that come into our building, right? That they all recognize and respond to the impact of traumatic stress. And the other thing that's really critical here, that this includes children, and it includes caregivers, and it includes us as service providers. We can't be trauma-informed if we are not paying attention to our own secondary trauma and vicarious trauma and compassion fatigue. So that's a really critical component. And I love that. That's another reason why I really like this definition, because service providers don't always get included in that, and we know how important it is. So that you're taking this awareness and knowledge, and you're infusing it into your cultures and practices and policies in your organization, right? That's really, really important as well. And now we're acting in collaboration. I know there's a lot of people here from CACs on here, from child advocacy centers, and we are masters at collaborating with all of the partners, right? That's part of why we do what we do, and why the CAC is set up the way it is because we have to collaborate and keep everyone in the loop. And so that's definitely a very important part, as well as using science. I've talked a little bit about that, using evidence-based practice, right? And TFCBT is certainly not the only evidence-based practice out there. There are many. So looking at what works, looking at what research and science has said, hey, this is a really good treatment model for this particular type of trauma. Or maybe you're working with families or adults and you're needing to find some type of family advocacy model that's been proven to work with families. So really looking into what the science says works. And then maximizing physical and psychological safety. We know child welfare is designed to look out for the physical safety of kids, but there hasn't been as much focus on this idea of psychological safety, which means, like, how do you feel? Do you feel safe, right? It's one thing to be removed from a physically abusive home, for example, but you then place a kid in a stranger's home, which is a foster home, and are they going to just feel safe immediately? Of course not, right? Like, the physical danger has been removed, but now there's that issue of psychological safety. And so that's one of the areas that we really, again, with this new space, are really trying to take to heart, like, how can we create a warm and inviting environment for our families where they feel really safe? Because coming to a CAC for many families is really traumatic, right? You're bringing your child to talk about something really bad that has happened to them, and families often don't know what to expect. So really, we have a responsibility to help create an environment of safety. And just another way of looking at it, something less wordy, the components of trauma-informed care according to SAMHSA. I kind of like these as three really concrete building blocks. So creating a safe environment, what does that mean, right? It's from what happens when they walk in the door and who do they speak to, how does your organization answer the phone and do intake, all of those kinds of things are about creating a safe environment. What type of signage, if any, do you have? Do you have any signs hanging in your lobby that that are inclusive, that make people feel welcomed, whether it's an LGBTQ flag or something really supporting the community that you serve? I mentioned, we just moved into a historically black community in Atlanta, and that's one thing that we really have thought hard about. How can we incorporate the historic community that we're in, as well as the population that we're serving? How can we bring some of that into our physical space and into help people feel safe coming in? Supporting and teaching emotional regulation, right? That is really important. That happens in therapy for sure. That's one of the big components of TFCBT, is this idea of emotional regulation. But also for ourselves, again, how are we self-regulating ourselves when we're having a bad day, or we're having a really hard case, or when we've had a really difficult forensic interview? How do we also regulate our own emotions so that we can take care of ourselves and come back and do it again the next day? And then building relationships and connectedness, that is like what we do as social workers and mental health professionals, law enforcement, right? Teachers, we're building relationships and connections with each other and with our families. And so this is just a little bit of a simpler way that I like to talk about trauma-informed care. So I want to talk, before we get into the actual tool that we use, I want to talk a little bit about why using a trauma-informed assessment is a good idea. First and foremost, it's a good fit for a CAC. We were a trauma-informed idea as a child advocacy center before that word or term was really used, right? Like, CACs were developed to minimize trauma, to enhance collaboration, to provide healing, right? We didn't call it a trauma-informed idea, but that's really what it was in the 80s when CACs came to be. And we also feel that it's best practice. So I mentioned a lot, all the training that we do, right? And so we've really felt like if we're going to be, talking all this talk about being trauma-informed, we really needed to also walk the walk and make sure that we were doing a good job internally of practicing what we preach, really. It's a great way to enhance your trauma-informed culture. I think even looking at how to create organizational change can be so overwhelming, you don't know where to start. And so the use of an assessment really helped us really figure out where are some areas of strength that we have that we can build upon, and what are some areas of growth, and how do we enhance our culture as a result of that. And then specifically at the Georgia Center at GCCA, for us it was a matter of timing. We had a 3-year strategic plan that was came about in 2018, so we're about halfway through. And one of the things that our strategic plan was very clear and laid out that we wanted to establish a trauma-informed, culturally competent service environment. So that was very clear in our strategic plan. That was put forth by our CEO as well as our board of directors. So having leadership buy-in on anything like this is really important. Creating change is hard enough as it is. To create change without your leaders on board, I think would be really challenging. So that's one other plug that I have to say. We have an amazingly supportive CEO who really wants us to be the best that we can, and we have a great board as well, board of directors, who really supports us. And so they were on board with this. And in order to do that, there were 3 things that we said we would do. One was conduct a trauma-informed organizational assessment. Then, based on that assessment, we would develop an implementation plan. And then lastly, that we would conduct an organizational assessment of cultural competency and develop an implementation plan based on that. So those were some of the goals for us as we were going into this idea of completing a trauma-informed organizational assessment. We knew that was in our strategic plan, so we were like, let's give this a go. And then we were like, well, what do? We don't know. We don't know what tool to use. We don't know what's out there. Which brings me to the NCTSN. So the NCTSN is an amazing resource for anyone. If you're not familiar, I highly recommend checking out their website, which is listed below. It's on the slide, nctsn.org. It is full of resources on trauma, trauma-informed care, and it's designed for really anyone in any system. So there are resources specifically by trauma type. For example, is it community violence is the trauma that you're looking at? Is it sexual abuse? Is it child sex trafficking? Is it like violence in schools? So there is a page for almost every system you can imagine, and then a ton of resources. So not just training curriculums, but fact sheets for caregivers, fact sheets for medical providers, fact sheets for judges. So I really can't say enough about it. They're an amazing organization and are just full of great information. So check out their website. If you have specific questions about the trauma-informed organizational assessment, which is TIOA, because we like acronyms. If you have any specific questions about this tool, I've also listed the contact person that you can reach out to. Her name is Carrie Perbeck-Trunzo, and she is really spearheading this effort. So I'll say in 2018, the NCTSN was looking for a site to beta test this new tool that they had developed. So this trauma-informed organizational assessment, they had developed it. It had been years in the making. They had tried to find something that was applicable to many child serving systems, right? Not just CACs, but anyone who works with children and families. They wanted something that could be used in all of them, and they couldn't really find anything. So they created a tool, and then we're looking for someone to be the beta test site. And so because we were an NCTSN member, and because this was a strategic goal of ours, it just was really a good fit. So I will tell you the status of the tool. They just recently, so after they did the beta test site with us, then they did a pilot, kind of like a pilot test with several other organizations. And so they've just completed that, and they're updating the TIOA based upon those pilot findings. But I'm told that any day now it will be available online, and it will be free. So another reason to plug for this particular tool is it's going to be free. So not many tools are actually free. So I will say we also appreciated the focus on multiple domains. So when I get into the tool a little bit more, you'll see it actually is assessing for multiple domains. Some of the tools that are out there are only looking at maybe one particular domain, like are you screening for trauma? Like they're looking at screening specifically. There's others that are specific to secondary trauma, like is your organization addressing secondary traumatic stress and how so, right? So we wanted something that was a little more robust, and so that was one of the reasons we really liked this tool. I'm going to have Sally or William, or they're going to enter a couple of links into the chat box because there are some other things that are not related to CACs for folks. So if you're looking specifically on creating trauma-informed child welfare systems in general, there's an entire page on the NCTSN website, and it has resources both for child welfare, for schools, for the justice system, as well as for healthcare. So that would be one place I would recommend you looking if you're looking for something other than the TIOA that I'm going to be talking about in a moment. And then there's also one specific to schools. So I know that there was a couple of questions on how does this look in schools and how does this work. So there's another a link that I received from the NCTSN. It's trauma awareness in schools. So that's another a potential resource for anyone looking for specific information in schools. And I'll also add there's something in the handouts that is very specific to working with juvenile courts. So the NCTSN has developed a trauma-informed organizational self-assessment for the juvenile court system. So that's included in the handouts here. So that is available for download. And my hope is that the TIOA will be available really soon. So again, if you have questions, specifically reach out to Carrie, but I'm really hopeful that the TIOA will be available very, very soon. So a little bit more about the TIOA. Again, I mentioned it's free and will be available online. It considers things that can be done at the programmatic, practice, and organizational levels. It's based on their long time, like I said, they were working on this tool for a couple of years, and then they tested it with us, and then they did a whole pilot test. So they're really trying to make sure that this is a good sound tool that's helpful. And I think the other thing I really like about it is it's specific to child serving organizations and can be used across child service systems. So it doesn't have to be just used in a CAC. It could be used with a child welfare organization. It could be used with a community service, agency. I suspect it could even potentially be used in schools as well if we're thinking about psychological services and social work services. So, and this is what you're seeing is the cover sheet of page 1. So it lists all the domains. I know it's really hard to see, so I'm going to show you those on the next slide. But just to help you understand a little bit more about the survey, there's 9 domains. And there's about 10 to 12 questions per domain. And participants answer those questions on the Likert scale of how often a certain practice takes place at your organization. So the question will be, the agency screens, for trauma. And the answer would be, 1, never, 2, rarely, 3, sometimes, 4, most of the time, 5, always. And then we did add an unable to rate category, which is going to be important, and you'll see about that in a minute. And I'll say the survey took about 30 to 60 minutes to complete, so it was a bit of a time commitment for sure, but we had all of our folks complete the survey. So here's the domains in a much easier format, I think, to read. So you'll see it ask questions about trauma screening, assessment and care planning, workforce development, resilience and protective factors, parent and caregiver trauma, cross-system collaboration, secondary traumatic stress, partnering with youth and families, and then lastly, the intersection of culture, race, and trauma. So really is a very robust tool, and we really liked the focus on multiple domains because that was really one of our goals. So the tool is designed to measure where your organization is at any given point in time, and I think for us, it also creates a common language around trauma-informed care. As you heard, as we were all kind of describing and defining what trauma-informed care means to us, there was a lot of variation in some of the language. There were certainly some similarities, but for us and really for anyone who's interested in using such a tool, it really helps create a common language for everybody, right? Whether you're a therapist or you're our fundraiser or you're our CEO. It helps create a common language among all of us. And it also will highlight areas of growth for your organization, as well as creating a roadmap to organizational change. And for us, this is important, identifying specific NCTSN tools that might help us reach some of our goals based upon the results of our assessment. Because we are an NCTSN partner, we have, you know, a lot of great support and access to those resources, but you don't have to be an NCTSN partner to use all their stuff. It's free online. Their website, as I mentioned, is very robust, so anyone can access those resources, can download the curriculums that they have, the fact sheets, etc. So really, you don't have to be an NCTSN partner and actually to benefit from this. And it'll help your organization assess progress and improvement over time. And I'll talk a little bit more about some of the goals that we set for ourselves. So this is also really hard to see. I tried really hard to get a screenshot from them of, you know, some of the questions, but this was the best that I could do. So you'll just see on here, for example, screening. This is what it actually looks like, this particular domain. So there's, I think, 10 questions. And like the first question, the organization systematically screens for trauma response and exposure. I think I read that right. So, and then, you know, you'll see, it's actually really hard to see, so maybe you won't see. But there's 10 questions on here. This gives you just a general idea of, you know, how the questions are asked. And then next I'm going to talk about our process in developing our team. So, the first thing that we did once we decided we wanted to do this, moving away a little bit from the tool itself, was figuring out, okay, now we know we want to use this tool, so what do we do? And the first thing really was to assign a project lead, and that was me for a variety of reasons, partly my role in the organization and my own experience in working in the area of trauma-informed care. As I mentioned, my work at the Chadwick Center was really focused on trauma-informed child welfare systems, and I learned so much in the 4 years that I was there just about what it means to be trauma-informed and what it looks like, and also having a pretty good understanding of not only the NCTSN, but CACs in general, because I have worked in CACs or with CACs for most of my career. So I was appointed lead, and then I was assigned to assemble a team. And so you'll see here is my team. I was very strategic in who we had join the team. We had someone from every department, so each department is represented, and we also had both locations. I mentioned we have 2 sites, so it was really important that we had the voice from everyone, from each department has a representative, as well as each location. And so when we got together and we were really trying to think about what our name was going to be, we came up with the A-Team. So naturally, that is Mr. T. For those of you who aren't familiar with the A-Team or Mr. T, he is the gentleman in front, and he is an honorary member of our team. So A-Team kind of was like, oh, we're the assessment team, so we're the A-Team. It just kind of made sense. And Mr. T is kind of like our Mr. Trauma. Like, we have him there to really remind us, like, are we looking at this through a trauma lens? So he's really a reminder for us, and also just someone who kind of keeps us going and keeps us on our toes, and we all love a little comedic humor. So that's our team. We have regular meetings and progress, which I'll talk more about, but we met pretty regularly, especially leading up to the survey. We met once a month for about an hour. Now, I realize some of you might be saying, well, I don't have 7 people at my organization. Like, some of you may be the only person at your CAC. So, you know, that's going to be a challenge. There's going to be some challenges depending on, you know, the type of setting that you work in. So if you're the only person or one of just a few, like, I really recommend first starting with your leadership, like getting your leadership on board, figuring out who that is, and then, you know, finding your trauma champions. And maybe there's only 2 of you, but that's okay. I think also reaching out to some of your MDT partners, right? Like, who do you work with in child welfare or your DFACS organization? Like, who there do you think is maybe a trauma champion that you could go to, who could kind of help you and back you in this type of endeavor? Law enforcement is a great one, right? Like, is there anyone in law enforcement that might be considered a champion that would want to sort of help with this process? So you don't have to only do this survey within your organization. If you wanted to get together and do it as an MDT, especially if you're a smaller community and there's fewer of you, that might be a really great way to not just tackle your own organization, but also your system as a whole. And then you need to decide who's going to take the survey. For us, it was really, really important to hear from everybody. And so we had everyone complete the survey. We are a staff of 34. As I mentioned, we don't have 500 employees, so we felt like 34 was a really easy, well, I shouldn't say easy, but a manageable number. So once we had our team together and once we all completed the survey, I think we left the survey open for about a month. So everyone got a link, and there was a lot of talk up to that point, and our CEO was encouraging folks to complete it. And in fact, she bribed us that if we had 100% participation, we would get some swag. And we did. So we all got some really cool umbrellas. It rains a lot in Atlanta. So we got big umbrellas with our logo, which is a really great gift. And so we had everyone complete it, which was, again, was really important for us to have everyone's input. And so once we did the survey, we got some great consultation from the NCTSN. They actually came, did a site visit, and helped us walk through the first couple of domains. As I mentioned, there's 9 domains and 10 to 12 questions each. So I think the survey itself is about 100 questions. So that's a lot of information to sort through. The NCTSN pulled together a report for us to help us understand where we kind of fell within each particular domain, how we scored in general, as a whole, how we differed by department, and I have some slides and I'm going to show you that in a moment. And so that was really important. So we then went to our specific departments and said, hey, you guys, this is kind of what we've done. These are all the domains. These are the results. These are some questions that came up. And what we also did was in the survey, in addition to answering the 10 questions on the 1 to 5 scale, we had an open qualitative response on at the end of each domain. Like, is there anything else about this domain that you want to share? Do you have any strategies or ideas for things that we could do better? And so we did get a lot of suggestions and a lot of strategies that we were able to take back to our respective teams. And then what we did was we prioritized. Okay, we've gone through these 9 domains, and that took months, really, truly months, to go through all that information. And then we prioritized, and we're like, okay, we can't tackle all 9 of these at once. Where do we want to start? And so for us, as an organization, our A team decided we wanted to start with the 2 domains of workforce development and secondary traumatic stress. And the reason being is that we felt like if we weren't as prepared and as knowledgeable as we could be as professionals, then we were going to burn out and not be able to support our families. So that is what we decided to focus on. We then identified tasks for 2020, which now, 2020, what's happened? So that's changed a little bit about how we're working. And this work has been ongoing. So our A team still exists. We're still meeting. And in fact, we've actually added a couple of members, which I'll talk more about in a moment. So as I see there's a question here about what the treatment is that's used for problematic sexual behaviors. It's actually I'm going to have to think of the appropriate acronym, but it's another version of a cognitive behavioral therapy, specifically for problematic sexual behaviors. And so there's some folks out of the University of Oklahoma that have been pushing this model, and we've been, again, through the grace of grants, we've been able to utilize their training. So I don't know if that answers your question, but it's a version of CBT, cognitive behavioral therapy. I think the other thing I'll just say, too, I mentioned this work is ongoing, but one of the things we kept coming back to is remembering our why. As we were, crossing off some things on our list in terms of, we said we would make a list of all of our partners. We said we'd create an elevator speech. We wanted to create a trauma-informed, we give tours at our building a lot, right? And that's a way of getting donations and volunteers, getting the community, interested and involved in our work, creating a script that was for a trauma-informed tour, right? And so as we were going through these things, it's really easy to get lost in the weeds and wordsmithing and, trying to figure out which word you like best, and we kept having to ask ourselves, like, what's our why? Like, the whole goal of this is to make sure that we are doing all of these things with a trauma-informed lens. So even as we were doing the work as a trauma-informed team, we would sometimes get lost, and we would have to remind ourselves that we're not just creating this list to create it. We're not just creating a tour, a tour spiel to create it. We want it to be trauma-informed, and we wanted to make sure that we had that lens throughout. So let's see what other questions I can answer while we're waiting on the slides. Can you address how to reduce trauma to poly-victimized children forced to testify in public hearings? That's a really great question. And I'll just say, especially when it comes to testifying, like forcing anyone to do, especially a victim, I'm not super in favor of that, but I understand it happens. And so I think one of the things that we do in general, the forensic interview, right, when we sit down with families and we provide them family advocacy services, we talk to them about what the interview is for and what it is intended to do, and that the goal is to have the child tell their story one time so that they don't have to repeat their story again and again. And so that's one of the things, I think, first and foremost, the forensic interview is really designed to help minimize that. We also have a therapist now. This is one thing that came up for us. We just have a therapist that's on site anytime there's a forensic interview happening at our organization. So that is to address any mental health issues that might come up in the interview, especially if the youth is triggered by something, or if the youth is coming in already potentially with some suicidal ideation. That's one thing that we have. So a forensic interviewer can take a pause or can bring that child to us, to our mental health provider, to assess that child in the moment. And we just really encourage all of our partners to use the interview as testimony, right? Like, that is, again, the whole point of doing this interview with kids, is to minimize how often they're telling their story and who they're telling it to. So if it is at all possible, the forensic interview should be used in place of testimony. So that's one thing I would share about that, I guess. I'm not sure that totally answers your question, but that's how we've handled it and how I approach it. So, all right, looks like we're back on track. Let's see. So I want to talk briefly about the timeline, just because I want to share to you before we talk about the results. I want to share that this has not been a quick or easy process at all. Especially when you think about creating culture change, right? It's a slow process. So we started this back in the summer of 2018. So a little over 2 years ago was when we developed the A team. We began to have our monthly meetings. We administered the trauma-informed organizational assessment in November through December. So I mentioned we had it open for about a month. And then in January of 2019, the NCTSN came and did a site visit and helped us review 3 of the domains, and kind of helped us figure out, well, how do we make sense of all this information, right? And so they came for a day, and we got 3 domains done in an entire day. So imagine we have 6 left. We spent the next couple of months reviewing the other 6 domains, and again, looking at what were some suggestions that people have, what was our score, what was the discrepancy in our score. So we had multiple meetings during that time. And then we did a staff presentation in April of 2019 to say, hey, we know we did the survey, so even 6 months had lapsed since the time we took the survey, and we actually had completed and compiled all the information to share with our staff. And so that was when we shared a little bit about what each of the domains kind of told us, and then really letting folks know these are the 2 particular domains that we are going to focus on. We're going to focus on workforce development and secondary trauma. And then we spent the rest of 2019 planning, creating strategies. Of course, we knew that the move was looming. We didn't know exactly when it was going to happen, but we were pretty sure it was going to happen at some point. We just didn't know when. So there was a lot of talk around our new space. And so we developed a very concrete set of goals for 2020. So we were feeling really, really good about ourselves. And then 2020 actually happened, and we're like, wait, this is not what we planned. What do we do now? So like the rest of you, we've had to adapt. All of our therapy services have gone to telemental health. Our forensic interviews obviously have continued to happen because those are an essential, that's just an essential part of the work that we do. So our forensic interviewers, have been, coming in and doing forensic interviews this whole time. We've had to implement, cleaning protocols and other types of COVID-related protocols, just changing the way families come into the building, only allowing one caregiver at a time instead of, pretty much anyone who wanted to come with the kid could come. So we certainly had to make a lot of adjustments. And then we were all working from home too. So it was like, are we moving? Are we not? Like everyone was at home. It was just a very strange time, which I'm sure that I don't have to tell any of you, that we are still actually in the midst of. I don't think any of us, I certainly didn't think back in March that we would still be living like this and working remotely in October. But here we are. So we've had to adapt. So I want to share a little bit about our scores, and I want to give a very clear disclaimer that for us it really wasn't about the scores. We didn't really know where we were going to fall in terms of, oh, we're doing great on this, we're not doing so great on this. But for us, it was not really about the score. It was really to look at what else are the scores telling us. So if you look at what you're seeing here, a radar chart I've learned, you'll see all the different domains around the outside, and then the 5, 4, 3, 2, 1, 0, which is unable to rate. So that's where the answers fell. So 5 being the practice happens all the time, 4 often, that kind of thing. So you'll see in looking at this, it actually looks, fairly trauma-informed. We scored pretty low. Our lowest score was on partnering with youth and families, which we were not surprised about. We scored pretty high in the cross-system collaboration, again, which we weren't surprised about because of our role as the MDT facilitator. Between our two buildings and the 2 counties that we manage, we have an MDT meeting once a week at one of our centers. So the community knows us, and they know who we are, and we have to collaborate in that area. So this is just a different way of looking at the overall scores. So you can see the ones highlighted in green are where we kind of scored the highest. So assessment, care planning, and treatment, again, because we're already using an evidence-based model in TFCBT, and the cross-system collaboration for the reasons I just mentioned. And then the 2 that we scored on the lower end, parent and caregiver trauma and partnering with youth and families. So this really brought up a lot of interesting conversation among our team about, well, we're a child advocacy center and we don't really serve caregivers, but are there things that we could do better with a trauma-informed lens to help our caregivers? Because we know that most caregivers that are coming to us, most children who are coming to us have caregivers who have also been traumatized. And sometimes it may have been addressed and sometimes maybe not. So while it may not be possible for us to provide therapy on site, like what kind of referrals are we able to give parents in terms of sending them out to not just any old therapist, but a trauma-specific therapist? How do we involve the caregiver in the child's treatment? Things like that. And then partnering with youth and families was another area where we're like, wow, we really got to do some work here. So this comes up in some ways that we've thought about. Anyway, sorry, let me start over on that. The conversations that we've had have revolved around what are some ways that we can really partner with youth and families to really help them feel included and help them feel like they have a voice, and help them influence the services that we provide. So that is one area that we are really considering. So looking at things like advisory boards, we've developed a survivor panel for one of our OVC grants. So we have a panel of trafficking survivors who have been really informing that project. Looking at our foster parent caregiver training, like how can we really get their voices into the mix a little bit more? Can we develop a caregiver support group? So those are some of the questions that we're having as a result of this. And then this one is where it gets kind of interesting. So here we're looking at average score by program. So again, the same domains, but this breaks it down by department. So you'll see that, for example, looking at our admin team, they typically scored things higher as occurring more frequently. So that includes our CEO, our fundraiser, our grants writer. So folks that aren't necessarily having direct care support, aren't providing direct care to our families, they rated these domains as occurring more frequently than folks who are actually providing the direct service, like clinical and forensics. I think especially you'll notice on the partnering with youth and families, there's quite a bit of disparity there. So while it looked like as a whole, yeah, we scored pretty well, but when you break it down by department, you really see that there's a lot of disparity in the scores, and that to me translated to a couple of things. One, it's based upon our role and our duty in the organization, right? Like if my role is not to provide therapy, I might not exactly know what's happening in therapy, and I might think that things are happening a little more frequently or a little less frequently than intended, because I don't actually know, because that's not my role. Then there's also the interpretation of the work that we're doing, right? Like some folks may be thinking that partnering with youth and families means one thing when it actually means something different. So this for us was really where we spent a lot of time talking about, well, where are some of these disparities coming from, and what do we want to do with that information? So I'll also share in prevention, which is the gold line in here, we have several folks that are actually in the community doing their community liaison. So they do all of their trainings in the community that they live. So they're actually spread across the state. So they don't even come to our office most times. So, you know, for them, it's really hard to know, well, I have no idea how you're partnering with youth and families because I'm out in the community training. So that's just one example of sort of where that disparity comes from. Okay. And then there's average rating by domain and program. So this is just, again, another way of looking at it for folks that like things laid out a little bit differently, like myself. You can see when it comes to partnering with youth and families, which again was our lowest score, you could see the variation, right? So our administration team thought, well, you know, their overall score as a department was 3.85. And you look at prevention, it's a 1.9. So that was a really big gap in like thinking about how often these practices occur. So this one in particular is something that we spent a lot of time talking about, and I think it's where we have the most work to do, for sure. And then again, on the cross-system collaboration, which is the one that we scored the highest on, again, there was a lot more consensus in that across the board, and I think that is really related to our role as MDT providers and facilitators. So there was a lot more consensus, and like, yeah, we do this really well, and so we felt pretty good about that. Thank you, William. I know you're like working hard over there to keep this moving and organized, so I appreciate all your efforts. And I see the time too, so I'm wrapping up. I've just got a few slides left. So these are priorities that we decided on in 2019, as I mentioned, before 2020 played a cruel joke on all of us. So workforce development is one that we decided we really wanted to focus on, and we really have no standardized onboarding process. So, you know, we have primarily master's level professionals in our organization, and we all come from, you know, different disciplines and different schools. So certainly there's been trauma education that we've all had, you know, academically, but when it comes to you know, onboarding staff and again creating consistency in language, we really don't have any type of process for doing that. So it depends on your department and who your supervisor is in terms of what kind of trauma training you receive. So that's one thing that we're really working on, and we've developed. We've found several local organizations One is actually the Child Welfare Training Collaborative that's housed out of Georgia State University. They have an online training that they provide to anyone, and it's free. So we really, again, like that. We like not recreating the wheel. So we are looking to some of our local partners. So that's an example of how we can use what's already out there. And also because it's online, that really is nice. We are a smaller organization. Well, I guess it depends on your lens, right? But it's not like we have 100 new people starting every month. So really to do in-person trauma training would be kind of a lot, and we wouldn't have enough people for that. But to have it be done online is a really great fit for sort of our needs. And then secondary trauma, so really looking at how can we enhance our commitment as an organization to staff well-being. So there was a lot of resources that we didn't have. There is a vicarious trauma group for our clinicians and our forensic interviewers, but if you're not a direct care provider, you're not able to access that resource. So that was one thing that we were trying to really, think about. And then I think lastly, we really don't have a method or a way of obtaining feedback from staff or monitoring STS. So we don't use reflective supervision, although I love that model. So that's one great way of doing it. But so really thinking about how can we get feedback from staff in like managing and monitoring secondary trauma. So these are our tasks for 2020. I mentioned this is another photograph. We are a CAC, so we have a bear wall, like I'm sure some of you may as well. This is actually from our old building, and you'll see where our bears live now in our new space in just a moment. But these were some of the tasks that we really wanted to tackle in 2020. So training protocol, which I already talked about, the elevator pitch and tour. We created a partner list. Defining what psychological safety means and creating a message board, so kind of a what do you need sort of message board or something for staff to like leave notes for each other. And we also wanted to have something up front also for kids and families so that they can leave messages for each other, messages of encouragement. And then the pandemic response was not an intended task for 2020, but we've had to figure that out. And those are our tasks for 2020. Some strengths, I already mentioned collaboration and our challenge areas, including partnering with youth and families. You need leadership buy-in. It's absolutely critical. This idea of what about caregivers, right? We really have to think about how we're serving our caregivers and what are we able to do for them. Even though we are a child advocacy center, how can we also support our caregivers in this process? So I'll just share quickly a couple of wins we've had. We've got new mental health coverage, which means our copay for going to therapy is a lot cheaper. We have an employee assistance program. We've got a new building, our Connections Matter training. Again, a lot of these I've already mentioned. This is our Hall of Hope and our new facility, so that's where our bears now live. And it's where kids can also leave messages and painted rocks. And lastly, I got one more slide, William. I'm going to do this quickly. So I mentioned that we are a large CAC in an urban area, so we have access to resources. We have access to all kinds of resources, actually. And so for more rural areas, that could potentially be a challenge. So again, our services also are free, so not having to bill for services and things like that really helps. And, we have staff that are dedicated to this cause, right? You have me leading a team, and so we have a CEO who supports that and supports our time. And so for everyone, that may not be possible, and I understand that. So we also have a lot of strong community partners. So again, depending on where you are, you may be the only partner that you have in the community. So thinking about, who's around you and who can you team up with to not operate in silos and to do this work with. And then obviously being an NCTSN partner has given us access to a lot of great consultation and access to resources that we may not normally have. But again, anyone can access those resources, so I encourage you all to do that. And then we have grants. We have 2 federal grants that allows us a lot of freedom. When you have grant money, it allows you to do some really creative things that you may not otherwise be able to do when you're really trying to keep the doors open and kind of in survival mode. So just a couple of things for y'all to consider. And that is my time. Sorry I went over a little bit, William, but thanks for keeping me moving, and I'm going to pause, see where to go next.
Thank you, Jennifer, very much. I thought we would
Yeah.
start with just some questions. And the first one is, again, for those that may be signed on late, where is the assessment located? Can you talk again about how this will soon be coming out and where they'll be able to find it?
Yes. It will be on the NCTSN website, so it'll be on nctsn.org. And I can't tell you exactly where because I'm not sure and it's not there yet, but I'm also really happy to, I just spoke with the developers of the tool just this week in preparation for this, and I'm like, hey, is it there yet? And they're like, no, but we're working really hard. So I'm happy to send that link along to you, Sally, like a direct link to the assessment once it's available. I'm happy to do that, and you can share with folks on this call. I don't know if there's a way to do that, or you can just pump it out to the listserv that you have or something like that. But it will be on the NCTSN website.
Okay, thank you so much. And yeah, if you get us that link, we will get it broadly out.
I will.
And then just to
Definitely.
to point out to people that there is a handout specifically about the juvenile court in the handout pod above. So if people are looking, they can look for that as well. And the school information, I think, was put in the chat earlier.
Yes, it was.
Okay.
So I just want to, I know there's a question earlier about PSB. It's PSB CBT. So it's problematic sexual behaviors, cognitive behavioral therapy. So it takes the cognitive behavioral therapy model, just like TF-CBT does. The TF is trauma focused, so the PSB is problematic sexual behavior. So I wanted to be clear. And Oklahoma University actually is kind of the, I don't want to say the owners of the model, but they're the ones that have been doing all the training and consultation with our team. So yeah, hopefully that answers that question in a more thorough way.
Great, thank you. I'm going to go to some of the questions that came in as people's pre-registration as they were asked for questions that they may have for the presenter. And one of them is, how does the CAC engage agency partners in trauma-informed strategies? Yeah,
that's a really good question. I think, it has to be part of the conversations that you're having on an ongoing basis, right? Like talking about it at MDT meeting. I think, we have to model the behavior that we want to see in others, right? So demonstrating and modeling for them what we want to see and just creating space and even, mentioning it in an MDT meeting. Hey, we are, as an organization, beginning to think about what it means to be more trauma-informed, and as a CAC, we have many partners, including you. Like, we'd love to talk to you more about this, or do you have someone at your agency that would be willing to talk to me? Would you be willing to complete this organizational assessment with me, or would someone else from your organization be willing to? I think incorporating them into that process whenever possible is really, really important, and that it's a conversation that's ongoing, right? That we're not just talking about it one time, that we are really walking the walk when it comes to being trauma-informed.
Right. Yeah, great. Another question that came in was how changes in the organization will improve staff skills. I know you talked about onboarding, but how changes in the organization will improve the skill of staff?
Yeah. I think for us, again, it was consistency in language, and also even in an organization, I feel sometimes we operate in silos, right? Like, for example, as we were doing this, we learned that we have like multiple assessments throughout the process. So there's one assessment that gets done for the forensic interview, and the family advocate does that. And then when the kid comes to therapy, like, we do a whole nother assessment. And so thinking about, like, well, how can we marry those two so that there's only one assessment, right? And so that the family is being asked the same questions, no matter if it's by the forensic interviewer or by the therapist, right? So that was one example that we really talked a lot about and are looking at combining and creating one standard assessment as opposed to having several. And I think with the training, yeah, again, it's just creating consistency of language. And, you know, we all have, we work in the world of trauma, and yet we all have varying levels of knowledge about ACEs, even adverse childhood experiences, about resilience. And so, you know, we really wanted to create a model where everyone was getting the same information, that we could ensure everyone had a base knowledge of trauma, and really to help retain our staff, right? Like, we know that people that get burned out or maybe are experiencing high rates of secondary trauma, they leave the workforce. And so that for us is a way of trying to maintain our staff and also like have everyone really be their best selves and feel supported by the agency as well.
Right. Yeah, and what you just answered the next up question, which was going to be how does trauma-informed care extend to the interviewers? And the way that you mentioned, you include, you know, interviewers and clinicians and all of that work. But what about how quickly
oh no, go ahead. Well, I was just going to say, I think also having the, sorry, Sally, having, you know, it's not just about the interviewers having the information, but then it's having them communicate that in a trauma-informed way to families, right? Like, I can have all the trauma knowledge that I can have and think I'm really smart about it, but if I'm not communicating that in an effective and trauma-informed and psychologically safe way to our families, all of that knowledge isn't really helpful to me because I'm potentially re-traumatizing our families. So that for me would be an added layer to that.
Right. That's a great point, that it needs to be practically applied. Like, the best knowledge in the world won't help if we're not effectively communicating. So, and then there are some questions about how quickly improvements from the assessment can be made or implemented, and time frame. For just that implementation piece.
Well, you saw where we're at. We're 2 years plus in, and I will say COVID really put a damper on our ability to make some progress in these areas. I mean, I don't even really remember March or April, to be honest. We were all just trying to figure out how to work from home, how to do telemental health, how to do trainings over Zoom, right? And so figuring out how to do an elevator pitch was not at the top of anyone's radar. I think now we're a little more settled, and now that we've moved, and now we have the space. So that was part of the other thing for us, is we had all these ideas about the physical space, but none of us had actually seen the physical space, and none of us actually knew when we were going to be there. So now that that has happened, we're really thinking about, okay, where can we put the message board? Where would the one for the kids go? You know, we have the rocks. The kids, when they graduate therapy, they paint rocks, and they get to put whatever they want on it. But the idea is that they paint a word or something that summarizes either who they are or their experience, and then they're displayed in the Hall of Hope with the teddy bear, so that when new kids come in, they can see, oh, someone else was here, and they left a message that said strong or brave or you can do it. And so that helps kids feel safe to know that they weren't alone and that there's been others before them. And so just little things like that. Where can we put a message board for staff that says, like, I'm having a really bad day. I need compassion, or I need, you know, some words of advice, or I need strength, things like that. So really thinking about, so we're beginning now to think about that. So the short answer to that question is I have no idea in terms of how long, but I don't think it's going to be as quickly as you might think, because it certainly hasn't happened as quickly for me as I would have thought or liked it to be. You know, one thing, that the mental health coverage, I mean, that was our CEO really hearing us and saying, okay, we had a $60 copay to go to any provider, including a therapist. Like, that was kind of a lot for people. And so we got new insurance, and that only happens once a year, right? So we had to wait until, you know, a new year to make that happen. But now our copay is $20, which is awesome. We now have the employee assistance program, which we didn't have before. So there have been some things. I know how to move through those wins kind of quickly, but there have been some things that we've been able to really accomplish. I think overall, though, it's just put this on everyone's radar. Like everyone now, I mean, we'll even be in meetings. They'll be like, oh, what do you think, Jen? Is that trauma-informed? Like I'm kind of the, you know, the guru. And they look to me and they kind of jokingly, but, you know, people are thinking about it more and are even coming to me with questions about like, what's a more trauma-informed way to do this or to ask this question? And so I think it's on everyone's radar. But the change happens slowly, and this is no exception. So
Right.
It's taken longer than I would have liked.
Right. And we do have one last question, which is, what do you do if the message put on the board is not positive? Like if a child leaves a message that's...
Yeah, I think that's a really great question. I think we haven't done anything yet. We don't have a board. But in my mind, I'm thinking like, if it was something like, you know, this really sucks and I don't like coming here, like that's a real thing for kids to feel. And so in my mind, what we would do is not necessarily, I wouldn't remove that because other kids might feel the same way. And what we could do is put a counter response to that. Like, you're right, this is really hard. I'm so glad you came and you're really brave for telling your story today, right? So you're validating that, yeah, this really does suck and this is not fun. And you did it anyway, and we're really proud of you. And so you're kind of sending that double message to kids too of like, you know, it's not all going to be positive for sure, but we can acknowledge that and validate that and still provide a trauma-informed response, right?
Right. Great. Thank you so much. And thank you again for coming and presenting and giving us all this valuable information. I'm really looking forward to seeing this assessment, as I'm sure others in the room are.
Yeah.
So thank you so much for coming and sharing your experience.
Like a salesman trying to sell a vacuum that's not for sale yet, you know? Like, sorry about that. But I know it will be there soon. I know they've been testing it. Yeah, so I will be sure to send you the link, Sally, once it's up and available.
Great. Thank you so much. And with that, we'll turn back over to William.
All right,
Thank you all for having me and listening. I appreciate it.
Yes, yes, indeed. And thank you very much, Jen, for a great presentation. And thank you to our audience members for taking time today to sit with us during today's webinar. Before we conclude, I do have just a few last-minute items here just to go over with the audience in regards to some wrap-up things to discuss. Please, if you'd like to get in contact with OJJDP's INTAC, you may do so on the link here. You can also be sure to text INTAC to 22828 if you'd like to sign up for the OJJDP listserv. Please note if you'd like to get in contact with the OJJDP TTA Help Desk, you may do so by dialing the number here or reaching out to the email address located here, and you can also be sure to follow up with OJJDP at the website here. You can also sign up for OJJDP Juke Just Listserv by clicking the link here and seeing where you'll be able to click the link here where you can sign up and view upcoming events as well. Do you have a training or technical assistance need? Well, if so, please feel free to access the TTA 360 platform. Here you can submit any training or technical assistance need that you'd like. Again, as mentioned in the very beginning, please note that our webinar will be on our YouTube page in the next 48 hours or so. You can also view past webinars on this page. Simply click on the link here and it'll take you to the page. And if you'd like to get access to any supporting materials, you can reach out to the OJJDP TTA Help Desk. We have a few webinars coming up at the end of the month here, including a webinar with our colleagues with the Innocent Justice Foundation. Also a webinar with our colleagues with Zero Abuse coming up on the 3rd. And then we have another webinar coming up on the 4th with our colleagues with Innocent Justice Foundation, and another webinar on the 10th that is coming up with our colleagues at Zero Abuse, so feel free to register for each of those webinars. And finally, before we adjourn, just one last poll question for everyone. How do you plan to apply the information from this webinar to your work? Please note that this Oh, wait a minute. Hold on 1 second for me, audience members. This should be multiple answer. There we go. All right. How do you plan to apply the information from this webinar? Please note that this is multiple answer, meaning you can please select multiple items here, check all that apply, and let us know, how do you plan to apply the information from this webinar to your work? I'm going to leave this poll question up for a few more seconds for folks to complete and to go down the list here and let us know how you plan to apply the information to your work. And again, thank you all very much and have a great afternoon. Goodbye.